Good morning, everyone. I'm going to share my screen. We do have some slides to go along with our time together today. But thank you for being here to learn about teen sexual health and the role of trusted adults. Before we get into the nitty-gritty of what we're going to cover today, I think it's important for us to kind of ground ourselves in the work that our organization does, but also in the approach that we take toward working alongside young people to promote adolescent sexual health. So Amplify is the capacity building organization that supports direct service partners, school districts, parents, social service providers, clinicians, and ultimately young people to promote adolescent sexual health and well-being. At Amplify, we really believe in the power of young people and their right to self-determination. Research tells us that when youth have access to accurate, comprehensive information about their bodies, about relationships, about their health, the chance to clarify and build on their own personal values, goals, strengths, and environments that support and advocate for their growth and leadership, as well as access to invaluable clinical and social services, which we'll talk about today, they're the ones that make the healthiest decisions possible for themselves, right? It's not Amplify that prevents unplanned or mistimed teen pregnancy. It's the young people that do that work. They're the ones who prevent STI transmission for adolescents. They're the ones who set healthy boundaries in romantic and peer relationships and navigate issues of consent. But it's on us as adults to provide and advocate for the basic tools that they need to do that work. So our goal is to build, maintain, and improve a system in which all young people in Tulsa have access to those tools that they need. And we do that through three arms of our work: advocacy, collaboration, and education. And so that's why I'm really excited that we have all of these trusted adults with us here today. Because while most of the data and resources that we're going to review with you are specific to Tulsa County, that big picture message that we hope you leave with and the call to action that we'll talk about at the end really applies to all of us, no matter our role in working with youth, whether that's in our personal lives or our professional lives, and no matter your proximity to Tulsa. So thank you for being here. Just kind of a brief high scope of how we're going to spend our time. Today we'll be reviewing first some core data indicators for youth sexual health with a specific focus on Tulsa, and then working to broaden that context and make some meaning out of that data together. We'll review some key sexual health resources that, whether or not you live or work in Tulsa, may be available in your community. And then we'll highlight specific ways to access those resources in Tulsa. And then finally, we'll end with a discussion about the role of trusted adults in promoting sexual health and well-being alongside young people in the community. And so Heather's going to take it away and start us off with the data piece. So I will pass the mic to her.
Thank you so much, Jenny. I hope you all heard from what Jenny was saying, is that we are very youth-centered. We believe that young people are in charge of who they are. So that's a great introduction into talking about some of these topics. So to start us off, we want to kind of level set everyone on the data piece around adolescent sexual health and specifically teen birth rate. So right now, Oklahoma ranks fifth highest in the nation for our teen birth rate among 15 to 19-year-olds. We're still using 2018 data. The 2019 data has not been finalized yet. It's out there, but it's still preliminary. So the information is wrapped around the 2018 data, but 2019 data is very, very similar too. So just wanted to say that. We're third highest in the nation for our teen birth rate among 18 to 19-year-olds. So we know that there's still clearly more work to be done. There's a lot of progress and a lot of exciting momentum, but we're still in that top 5, top 10 that we can't get out of for a couple of reasons. And so breaking it down a little bit farther, you can see that in 2018, there were 3,512 teen births, and of which about 76% of those were to 18 and 19-year-olds. And so you'll see that consistently, that's kind of the breakdown. But want to remember that young people are getting pregnant at age 17 or 18 for these numbers. And so they might be finishing their last year or two of high school expectant or parenting. And so that has some difficult impact on their ability to finish their education. Specifically for Tulsa County, you're going to be able to see in this next graph, and that breakdown is there too. And it's still about that 76% breakdown. So it's consistent across the state, typically around that 15 to 19 and the 18 to 19. So our highest age group experiencing teen pregnancy is ages 18 to 19. Going a little bit further, you can see that that about 20% of those births to those groups are the second birth. And so not only do we want to think about preventing or working with young people so that they either delay sexual initiation or use condoms and contraception if they choose to be sexually active, it's not just about that first birth, but it's also about that second birth. And then you get into birth spacing and maternal health and implications as well when we're talking about a second birth within a short period of time for a young body. On the next slide is a great map of the entire state of Oklahoma that shows where we are. And so for nationally, our ranking is the US rate is 17.4 and Oklahoma's rate is 27.1. So again, that's what's keeping us in that top 5, top 10. We know that Tulsa County has the second largest number of teen births in the state with a rate of 24.2. So the counties that are in blue are counties with higher than the state average in 2018. But even though, like if you look at Tulsa County, it's white, it's not higher, but some zip codes in Tulsa County are 5 times the national average. So we're looking at some marginalized communities that might have some different disparities around the teen birth rate specific to Oklahoma. So this is just a great graphic for us all to see. And I like to see that there are so many participants across the state that are with us today. So what does all this mean? So this is a lot of data and teen birth rate and things like that. What does all the data mean specifically? And so we look at this information, really the purpose of the data collection and analysis around teen birth rates is in part to inform our decision-making, to improve policies, to monitor and compare from year to year what's happening. It's important to identify, who needs this information best and who's going to use this information. We believe that all young people have agency and power and the basic right to self-determination. And according to the CDC, about 77% of all teen pregnancies are unplanned or mistimed. We also know that teen births have outcomes linked to higher poverty rates, negative health outcomes, sometimes low birth weight infants, sometimes lower educational attainment. Like I said, if they're having a baby in high school, then they are going to have a difficult time either finishing high school or going on to technical school or community college or whatever that is. When we look at teen births, they really are a tri-generational impact. So it impacts the young parent, the young teens themselves. It impacts their parents because they're typically still living at home. And then it impacts the baby as well. So lots of outcomes and lots of ways to think about what the implications are of a young birth for expectant and parenting teens. But I want to strongly underline the next statement I'm going to make, that these poor outcomes associated with early pregnancy and parenting are an indictment of our system. They are not an indictment of that young person themselves. They're an indictment of the system in which it doesn't support either our young people access to education and information to make different decisions. And then it also may not support expectant and parenting teens to be able to go on and complete their education and get further education and training so that they can get an affordable way or a living wage. So that's a really important key part of the way and foundation that Amplify does our work. So importantly, young people do deserve that agency of their lives and futures. And we know that when given access to that information and resources, they are more likely to delay initial initiation of sexual intercourse and use contraceptive options when they do. On the next slide is that we talked about that positive momentum. So over the last 25 years, the teen birth rates have declined drastically. In the last 10 years, it's been unprecedented for health indicators in the over a 50%, almost 60% decline in that teen birth rate. And so what's really exciting about that is that we get to keep up this work. We get to keep up that momentum. And so it's a huge decline. What that really shows to us is that education and access work. But we also know that this isn't the only indicator of what's going on with our young people. So sexual health and well-being involves far more than just unplanned pregnancy and STI prevention. Teen birth rates are always going to remain that major metric of our collaborative success, but we know that addressing adolescent sexual health is more than just about in the absence of a pregnancy. It's not the complete story of the good work that our partners are doing. And one example of that broader scope of this work is that sexual health education implemented around Tulsa public schools and around Oklahoma City public schools. We know that there's a lot of efforts to ensure that students are getting evidence-based, medically accurate sexual education that they need. We also know that addressing adolescent sexual health is about health and well-being and kind of more this holistic look at that. And so we're doing great work. There's lots of great things happening. And yet we still know that there's a lot more work to do. Health inequities persist across racial and ethnic groups. There's still no state mandate for sexual health education, although right now in the legislature, there is a mandate for health education that we're hoping that gets passed this legislative session. There's no state dollars for teen sexual health programs in Oklahoma. According to the YRBS, we see that condom use might be declining. STI rates are rising, particularly in that younger demographic. Sexual violence, dating violence are concerns. There's a lot of work still here to do. And then we know that gender and sexuality-based bullying, harassment in schools continues to impact young people at school and online. And right now, when so many of our young students are experiencing school online, then that can exacerbate that issue as well. So while we look at the progress around teen birth rates, we know that there's so much more that we can do to support our young people. On the next slide, I want to introduce a framework that ETR has put together called the Health Equity Framework. It's kind of a next step to the social determinants of health, but you can see that it's an intersection, these complex interactions between people and their environments. And so it's talking specifically here about health and education outcomes. And we know that health equity arises from access to those social determinants of health. And so it's important to recognize that when we are designing programs and services and interventions, that we know that we're not doing it in a vacuum, that there's a lot of systems and individuals and networks at play that have an impact here. And it's important to highlight this and maybe introduce this to a group like you all who have those interactions. You've got those relationships and networks with young people. You're existing in a system of power with them as well. And so how can, focusing on equity have a very positive impact on the work that you do with young people? And this also kind of introduces a little bit of a social justice lens. So here we believe that young people, all people, have a fundamental human right to know how their body works, to have access to healthcare and reproductive healthcare that will support a lifetime of positive health outcomes for them. And we want to make sure also that the systems and that the data that we use and the programs that we design are a fit and support marginalized communities and may not where sometimes that data might work against them a little bit differently too. And also that we're always very youth-centered in the work that we do. So this may be a new framework for some of you. It's very interesting, and ETR has a lot of resources around this too. And that's a great segue to hand it back over to Jenny, and she's going to talk a lot about the resources that are available.
Thanks, Heather. So let's talk a little bit about resource networks, what they look like, what might be possible in your community, or what exists specifically in Tulsa. Again, we're going to be highlighting specific programs that do exist in Tulsa County, but if you don't live here, you may have similar resources available in your area. And so we wanted to make sure to encourage you to research and vet what is available in your community and to know what's happening in your local area to be able to best support young people. Before we talk specifically about certain programs, though, I think it's important to note that while there are no state dollars for teen pregnancy prevention, federal money does get funneled through state agencies. And so we'll talk really specifically about the Title X program and what that can look like in support of young people. And then there are other federal grants that come down through the Office of Population Affairs and the Administration for Children and Families that support sex education research and implementation. It's also really important to note that Tulsa's philanthropic community recognizes the need for evidence-based education and clinical programs. And so the investment by our local foundations is a really core component of our resource networks. And many of the things we'll talk about today would not exist without them. So the first component that I want to highlight is sexual health education specifically, and kind of give you the distinction between an evidence-based program and a program that has not yet been evaluated. So at Amplify, we typically support curricula that have gone through a randomized control trial, meaning they've been tested for specific outcomes. In the absence of a state mandate, that's not necessarily a guarantee in every school system, right? That the curriculum being delivered is aligned with the national sexual health standards, or that it's been proven to be effective. And so knowing what information is offered to your young people that you're serving can be a really powerful tool to figure out what information do they already know and where might those gaps be. So there are some fantastic curricula in Tulsa Public Schools, for instance. Every 7th grade science and high school biology student is going to receive a comprehensive, medically accurate, trauma-informed program in the school-based settings. But there are also curricula for community-based settings and curricula specifically designed for youth in systems of care. And so I'll make sure to send out a link to one of those curricula as well if you're interested in kind of learning more about what programs exist if you're working with youth that are involved in systems of care. So in Tulsa, Youth Services of Tulsa and the Tulsa Health Department each have a team of highly trained certified educators that are available to go into school systems and implement evidence-based programs. And then there are also individual school districts that are implementing programs as well. In terms of Title X, so I am actually going to drop some handouts into the chat for you that kind of outline what we call teen sexual health rights for Tulsa County. And this can be used as a resource for your staff or for the young people that you serve. And it kind of gives similar information to what we're going to talk about related to Title X. So Title X is a federal program that makes free or low-cost family planning services available not just to adolescents, but to anyone living within a certain percentage of the federal poverty line. For our focus, though, when we talk about teens, it's really crucial to their health care, because when they access a service through a Title X clinic, that service becomes confidential. So it becomes protected in the same way that an adult accessing clinical resources would be protected. And they can consent to their own services. So they don't have to have parent or guardian consent to be able to access those services at a Title X clinic. Now, it's also really important to know that just because a clinic has a Title X program, that doesn't mean that all appointments, depending on when they're scheduled, fall under Title X. So finding out the details of your community's clinic operations can be really crucial to helping youth navigate these critical health services. So, asking questions like, are there certain days of the week for teen clinic? How does someone specify that they need a Title X appointment? What language do they use, right? Is it family planning? Do they mention Title X specifically? And then also finding out if there are any creative ways that clinics are using to get condoms out to the community. So in Tulsa, anyone can go to a health department, walk up to the counter and ask for what's called a brown bag special, and they'll be given a bag of condoms, right? That may look different in different communities, but knowing that kind of opens doors for access. And so all of these sort of like Find a Clinic, Tulsa Health Department, and Community Health Connection that you see on the screen have links associated with them. And so when Haruv sends the slides out to you all, you'll be able to have easy access to those resources. Making sure that maybe you understand if there's a contraceptive access program specifically in your community. So in Tulsa, we have a group called the Take Control Initiative who partners with clinics to provide all contraceptive options free, including long-acting reversible contraceptives, or LARC. LARC are going to be methods like the arm implant or the IUD that are sort of like a set it and forget it model. They last for anywhere from 3 to 12 years, depending on what option someone chooses, and can be really effective over a long period of time. TCI also, during the COVID-19 pandemic, launched doorstep condom delivery, which is another really exciting resource. So on their website, which again, you'll have the link to, you can email or call the contact information and have condoms directly delivered to your home at no cost. And then are there any healthcare navigation resources, right? So we talked a little bit about kind of vetting resources, knowing what clinic operations look like, but we know that sometimes navigating healthcare is complicated. And so in Tulsa specifically, there's a program through youth services called Health Education and Prevention, who remove barriers for young people in this way. So they can assist young people in scheduling appointments, including not just family planning and STI testing, but also prenatal care if they are expectant, and then transportation to those clinic appointments, which is huge. Knowing and understanding if there are specific supports for expectant and parenting teens. So in Tulsa Public Schools specifically, there's a program called Strong Tomorrows who provide case management. They do a dual generational approach to education, so supporting the folks who are parenting in their high school graduation, college and career planning, and then they partner with high quality childcare programs like CAP and EduCare to ensure that their children have access to that same high quality education piece. And then making sure there are appropriate medical and health referrals and engaging them in parent workshops as well. So knowing, are there specific targeted resources for young people who are expectant in parenting that I can link my clients or the young people that I'm serving to. And another really, really core component to be aware of is specific group support for LGBTQ students. And so in Tulsa, we have social and support groups that are meeting virtually, normally in person, but virtually during COVID-19, school-based gay straight alliances, and then other leadership programs. And so the organizations offering those in Tulsa are going to be Youth Services, Campfire, and Oklahomans for Equality. I think TPS specifically is getting ready to start their first district-wide secondary GSA in a virtual format. And so being on the look for that as a referral opportunity can be really important. And then finally, if you have any organizations similar to Amplify in your community, making sure that you know who those are. So we have a sister organization in the Oklahoma City area called Thrive, who does very similar work in supporting the community efforts on teen sexual health. And so at Amplify, we provide capacity building. We support the implementation of sex education in collaboration with other partners, trainings like this one out in the community or to sexual health educators, school administrators, and then advocating for policy change. And so I would also just add a plug in here that if you have any specific question or resource need or anything like that, never hesitate to contact us, because we want to make sure to get you linked to the best possible information. So there are a lot of great ways to get young people linked to programs and clinical services that we know give them the opportunity to determine if, how, and when to start a family. As adults, it's important that we know and can help link them, but there's an equally important piece to the role that we play, and that's our relationship to the young people in our lives and the young people we serve professionally. Heather's going to speak a little bit more about this critical piece of the work.
Thank you, Jenny. So when we look at all of these health indicators, what we also really want to look at is how can we make it better for young people? How can we make our communities stronger? How can we support young people? And so many of you may be familiar with positive youth development or the youth development approach. And so prevention science has investigated the question, how can we predict and prevent negative behaviors? And so they've looked at identifying risk factors or conditions that increase the likelihood of negative outcomes, and protective factors, which really buffer against these negative outcomes. So some of those questions around resiliency research has been more like not what's wrong, but why do some young people do well in very difficult circumstances and other young people don't? And so some of those answers are wrapped up in positive youth development research, what those thriving indicators look like that have come out of resiliency research. And a lot of it is based on longitudinal studies that have followed groups of individuals over years from childhood to adulthood. There are a lot of groups, the Forum for Youth Investment, Search Institute, Annie Casey Foundation, a lot of groups that are looking at that positive youth development piece for how can we support young people to grow up, to be ready for adulthood, capable, responsible, thriving, regardless of the situations and circumstances and systems that they grow up in. So this really moves it out of that problem-centered language to focusing on what can we promote and support for young people. And I really love the approach and the framework. Search Institute is one of, and if some of you may be familiar with Search Institute, they identified what they call 40 developmental assets, or things that all young people need to grow up healthy, caring, capable, responsible, and engaged. And in a nutshell, if I was going to talk about assets and risk behaviors, the more assets a young person has in their lives, the less likely they are to engage in risk behaviors. The more assets that a young person has in their lives, the higher the likelihood that they're going to thrive in whatever circumstance that they're in. And so that's really, and they've done a lot of years and years and years of research to find that this is consistent over time around the different assets. Another very important and core component of that is those trusted, caring adults in their lives. And so they've furthered this concept of developmental assets into what they are calling developmental relationships, highlighting this power of one and really what is, and I forgot to look up the person, and I need to do that, and maybe we'll send that out with the links too. With this lady, I think she's a teacher, had a TED Talk a few years ago, several years ago at this point, saying that all young people need one person who's crazy about them, who pours everything into them. And that is truly, we really need more than one, but at least one. And there really is a lot of power. If I were to ask each of you right now to think about when you were in middle school, 6th, 7th, 8th grade, was there a non-parent, non-caregiver adult in your life that made a difference, that made an impact? Can you think of one person? Think about that person, and maybe it was a coach, maybe it was a Girl Scout leader, maybe it was a neighbor, but we all have those because it does take, it's not to sound cliche, but it does take that village. And I think what we've seen even in the pandemic with young people is that when they had to go home and be in virtual or distance learning, that it took a lot of adults out of the equation in their lives, those teachers and counselors and other people that they could rely on. So we know how important caring, trusted adults are in young people's lives. And that's you all, that's you all as you're doing youth work, as you're serving and supporting young people as clients, or as just loved ones, whoever those young people are in your lives, that it's so important and has such an impact. And so when we're looking at this whole entire complete picture about what communities need, if I was to say what positive youth development is, I feel like it's communities just hugging their young people, hugging and supporting all the young people that they have in their lives, to support them in whatever avenue that is. We focus on youth sexual health because we know how important and what a core component of foundation and positive health outcomes that is for life. But there's a lot of other avenues here to support our young people. So just wanted to highlight that also as another framework and another way to look at how to support our young people. And there's tons of resources out there too that you can access around positive youth development. And now Jenny's going to talk about some more of those specific strategies for supporting young people for making healthy decisions about their sexual health.
Yeah, so in kind of crafting this, we thought we wanted to leave you with at least, if you left with nothing else today, right, at least 5 things that you could potentially start doing right away if you're not already doing them, or if you are already doing them, then thinking of ways that you can strengthen that strategy or kind of give yourself a pat on the back for doing what we know works. And so the first piece of that is recognizing that young people are really the experts on their own lived experience. It's very common, I think, for adults in general to do what I think of as solution jumping, right? So thinking about, I know what's good for this young person. I know what they need to do if they would just stop doing X, Y, Z, right? When the reality is we're perfectly positioned to be able to come alongside them and help them work out solutions in the long term, right? They're going to be the experts on their strength. They're going to be the experts on what is going to work for them or what isn't going to work for them. And sometimes opening the door to those conversations can be a really powerful intervention in and of itself. The second is to focus on relationships. So I love that tool that Heather mentioned, that developmental relationship framework. And I actually dropped a PDF in the chat that kind of breaks down those 4 components and specific strategies under those components. And I think one of the most powerful pieces of that developmental relationship framework is that it's not something that just happens by magic, right? It's something that adults can intentionally build and practice skills in, which I think sometimes can free us up in a way to be more self-reflective on, am I really sharing power, right? Am I really showing care, more than just kind of like the emotional aspect of it, right? And third is to normalize conversations about sexual health and relationships, right? Sometimes I think we have this idea that, well, if they're getting sex ed in school, then that's where that conversation happens and stays, and they're, you know, it's not my job, right? It doesn't fit in with my role. But we all have a role to play in that. And the reality is that our sexual health, our sexuality is something that impacts us from the time we're born until the time we die, and in lots of different relationships, romantic or not. And so as trusted adults for young people, being there to have those conversations and not be afraid of those conversations can be a real difference maker in helping young people think through their behavior or their goals and how they're going to achieve them. Number 4 is assess your agency's approach. So really think about, is it teen friendly? Do young people have a voice and a choice in the services that we're providing? Is there space for a young person to bring up an issue or a problem that maybe doesn't feel directly related to what I'm working with them on, right? Have we kind of fostered that culture of bi-directional communication and bi-directional learning where they feel capable of playing a really large role in their service delivery, right? And engaging in that. And then finally, vetting your resources and referrals and not being afraid to use them. Those teen clinics only work if young people know that they exist and have access to getting there, right? Understanding, I think, what exists in your community and the best way to get a young person linked can be a really powerful tool. And I think that's all. We have lots of time left for questions. I think we got through our content a little faster than we thought we would. So I'm eager to hear kind of what you all think and if there are any thoughts or questions you'd like to share.
Thank you so much, Jenny and Heather. And we're waiting for some questions to pop up either in the chat or if folks want to unmute themselves and ask. I just want to say that I've had the pleasure of writing a literature review back home in Israel for the Ministry of Welfare about promoting sexual health and preventing sexual assault among adolescents. And I'm so glad to hear everything that you've discussed, which really lines up with what we know today from, the literature internationally. So I'm so happy that right here in Tulsa, folks have access to resources that are so, that are all evidence-based and really up to date. And I do want to say that some people on this call might be asking themselves, well, Haruv deal with child maltreatment. How does that have to do, with sexual health? And I just want to say that according to CDC guidelines, the most updated guidelines, one of the first strategies that are described in the literature in terms of preventing of sexual assault amongst adolescents is teaching sexual health. So one cannot go without the other, right? We want to keep, our children, our adolescents safe. We need to be discussing sexuality with them. We cannot just expect, them to know about this. And this is a huge part of their lives, right? If we're not talking to them, they're learning from somewhere, from probably things that, shows, TV, pornography, and some resources which are not the best resources. So just commenting on my behalf. So we do have a question from the chat. Do you have any specific advice for working with LGBTQ teens on sexual health, specifically transgender or non-binary youth?
Yes. So there are specific best practices related to, I think it's easy sometimes when we think of like targeted interventions for a specific population, but there are even best practices that are just good for all young people for us to be using in conversations that end up really supporting young people who are trans or non-binary. And that's when we're talking about, there's several, right? The first that comes to mind for me is when we're talking about bodies, as opposed to referring to a body as a female body or a male body, using language like people with uteruses, right? People with vulvas or people with penises, because that kind of expands out past that identity piece and allows people to think about, okay, what actually applies to the anatomy related to the question that I'm asking here. In terms of like climate setting, right? Introductions with pronouns can be a really beneficial tool that benefits everybody, right? Again, not just young people who come from that identity, but also gives them the power to maybe feel safer in that environment and in sharing what we need to call them or what we need to use when we talk about with them or talk about them in the third person. What else would you add, Heather?
You said exactly what I was going to say, especially with the pronouns, making sure it's a safe place and comfortable. I might also add, reaching out to the groups in your community that specifically work with LGBTQ youth to support that. I don't know what community you're in, but there are a lot of resources in different communities so that there's some specific literature. But, and what Jenny said about talking about a person with a penis or a person with a vagina, that's really important. And when we get some pushback on that, I think that the appropriate response might be that, and this might take us even further, but, gender being a social construct, and we really do focus on the biological and physiological aspects of, supporting young people. So that's one way also to look at that, as well as, focusing on, medically accurate and what is, anatomically correct, and those kind of pieces to support how young people are feeling. Because at the end of the day, the question to ask yourself is, am I supporting a young person? And so whatever that looks like and feels like is the answer. That's what you need. How am I supporting all young people? But I would really lean on the LGBTQ specific resources in your community also.
Thank you. We do have a recommendation in the chat about Transpire Oklahoma as being a great resource for trans and non-binary individuals. And then we had another question in the chat, which I'm very happy that we do have this extra time to have some conversation and have time for people to ask things that they are working on. So you can go ahead and ask more questions, everyone. So do you have any specific advice for working with teens who are in active addiction or parents in active addiction and addressing sex/drug linked behaviors?
So I think what comes to mind for me first is those harm reduction models, right? So making sure that young people understand, there's that safety piece, right? There's that consent piece. And so making sure, I think safety probably is the baseline thing to address first. But then if we're thinking about like a long-term plan in terms of how am I going to keep myself safe? How am I going to keep my sexual health or stay as healthy as I can related to my sexual and reproductive health while I am dealing with active addiction or working towards entering recovery? What are some tools that are available to me to help mitigate anything that might come about from risky sexual behavior that maybe is linked to substance use, right? And so conversations about condoms, conversations about contraception, those kinds of pieces, I think they can be talked about kind of in tandem because they can be so interrelated.
Jenny, I want to jump in, and you saying that has me thinking about, I spent some really important years of my career working for Youth Services of Tulsa in the street outreach program. So working with young people 16 to 24 who were experiencing homelessness. And a lot of times with young people who would come into the drop-in and start chatting, I would learn that they were struggling with addiction, that they were engaging in some really concerning high-risk behaviors that really, it sent all the bells going off in my head, all the red flags. But sometimes it was just about asking them, like, when do you feel the safest when you're, so sometimes it's like, they would say, well, if I have my friend with me, right? So then we would talk about this buddy system, or do you have a cell phone that can be with you and charge? Do you always have condoms? Do you feel comfortable having that conversation with someone you're engaging with sexually, about asking them, do you want to talk that out? Like, do you want to role play that so that you have some practice, like letting them really lead it, but whatever thing that they came up with, following them there. Because at the end of the day, I was going to go home and be in my safe home. They were going to be out on the streets making decisions. And so I wanted to do whatever I could to prepare them, and then partnering with organizations like, I remember Sam Young with Hope Testing would just deliver bags of condoms for us. So we always had them at the drop-in so we could send young people with them, and bring in people like Amplify to talk to our young people, make sure that they had the information that they needed to understand their bodies, know if something wasn't right, if something didn't feel right, all of those things are so vital. But harm reduction models are like, I'm such a champion for them. It really allowed me to support young people in making the best decisions that they could, knowing that at the end of the day, if I said, don't do that, I'm not going to be there. They're going to feel judged. And then, that might put them at more risk later. So
I love that. And I love that you're sharing, because I think it's like the real life example of that youth are the experts on their lived experience, right? They know, they're the ones that, yeah. Thank you.
I was hoping to ask a question, if that's okay. My name is Monica Perez. I went to school in Oklahoma. I'm back now in Canada, which is the country of my birth. So it's nice to see some familiar faces at the presentation. For those of us that are working, I work primarily with an Indigenous population on a very impoverished, here in Canada, it's a reservation, I believe, down there. For a lot of the young girls, especially that we are working with as a child welfare organization and taking care of, for a lot of these youth, parenthood is the only pathway to any kind of life attainment, even if it is under less than ideal situations or circumstances involving poverty and that kind of thing. How do we balance wanting to assist these young people to be healthy, happy, whole, when for many of them, the only pathway they see in terms of a future for themselves is parenting, even if that's very early on in their lives, even under really challenging economic circumstances, being surrounded by sexual violence, drugs, all of these kind of factors that make it difficult for us to raise happy, healthy children safely. I'm curious as to your thoughts on that.
Either way, Jenny, if you want to go ahead, I have some thoughts, but
go ahead and then I'll hop in.
Okay, so one of my initial thoughts is thinking about supporting their goals. You know, supporting their, you talk about goals, dreams, and then thinking about what those barriers are, what those challenges might be for them, and then helping them figure out the path to what it is that they are hoping to get out. Long-term planning, but 3 years, 5 years, and you said young. I don't know how young you were referencing, but one of the things is talking about, okay, parenthood is a hope and a goal and a dream for a lot of people. And so thinking about the timing of that and what having a child or getting pregnant and having a baby at this age, versus this age, the different challenges and barriers, and helping them think through what their own challenges and barriers might be, is one way, to start thinking, helping them understand what the path might be for them. And so that was my initial thought. I don't know, Jenny, what else you have some thoughts too, but thinking through, okay, that's a goal, and having a child is absolutely a goal, but the timing of it and how many to have within, because once they have one, they're probably going to have another pretty quickly. Then thinking through what all that might look like for them, but helping them to understand and determine their goal and their path and what the steps are to get there.
Yeah. What I was going to say was something very, very similar to that, just in terms of it's a delicate balance, right? Of it's not super helpful for us to go in with preconceived ideas that becoming a parent is wrong or bad for this young person, right? And just like that CDC statistic, right? If there are 77% are mistimed or unplanned, that means that 23% weren't, right? And it's not necessarily, organizationally, we don't feel like it's our job to tell young people teen parenting is bad, right? It's more, how can we support you if this is ultimately, how do we support you in making the most informed choice that you see as right for yourself? And then once that choice is made, how do we support you afterwards?
Yeah, it really is about support. Thank you. I just want to say that in the chat, I saw that Nancy Mason said that they have a great tool with Native. Nancy Mason is with Muskogee Creek Nation here in Oklahoma. And so it sounds like they have a good tool also with planning that's specific to Native youth.
Dijon, did you wanted to add anything?
I was going to highlight exactly what Heather shared, that there's an email there from, I wasn't sure the name because it's under youth services, but it sounds like it's Nancy with Muskogee Creek Nation, a specific tool that can be used with Native youth. And so just wanted to make sure that was lifted up. I'll read a couple of comments that we've also received. Is it Zaida Castro? Is that how you pronounce your name? Okay, I just wanted to add that as a matter of equity and inclusion at Amplify, we are making education resources and information available to non-English speaking parents and youth by professionally translating materials into Spanish. And if you noticed, if you clicked on the links that Jenny shared, everything that they're sharing with us, they have English and Spanish resources, which is amazing. Yasmin shared that she loves the translation provision as well. We have a comment from Oklahoma Family Network saying some of the evidence-based curriculum like Positive Prevention Plus has a module that helps the students see their future and what the barriers can be and how to get to your goal. So that's a great specific resource to piggyback on what Jenny and Heather were just unpacking. And then Melissa Miller has a question. Do you know of program like Strong Tomorrows for teen parents in the Sand Springs school system or any other teen parent support resources in that area?
Yeah, so I'm not aware of a program specifically like Strong Tomorrows operating anywhere else. I could be wrong and could do a deeper dive and make sure that that's correct. Sometimes health departments also have programs intended to support on kind of like that medical or health side when a young person becomes expectant and kind of helping them walk through that pregnancy. Like I think in Tulsa we have a program called Healthy Steps. So there are some case management services for clinics or health departments as well.
And there's a new initiative in Tulsa called the Tulsa Birth Equity Initiative, and they are supporting, they have community-based doulas, and they support teens. There's different groups that they support, but they support teens, no matter what, all teens who want to have that community-based doula support, and it's starting at, I think, maybe around 20 weeks. I'm not exactly sure, but Tulsa Birth Equity Initiative is what they're doing, and they're supporting through the pregnancy and labor and postpartum. And it's not geared necessarily towards school support, but it's towards social emotional support during their pregnancy, which they have, teens have unique needs during their pregnancy. They need support to advocate for what they need and with good health care, because it's different.
That's another great resource that I think I'm glad that the professionals on this call are able to have. I'm thinking about just a couple of things that I wanted to say, which have to do with some of the last questions that we discussed that came up in the chat. One is, I think, and I loved Monica's question because I thought it was so relevant. I've had similar conversations with young women in Israel who did kind of, I don't want to say the word fantasize because it might sound judgmental, but there was kind of a fantasy of, building a new home, which will be so different than a maltreating home that they grew up in. And I think that one of the things we really need to think about is, do we have enough spaces for young people to be having those conversations with trusted adults? And I really think that we just can't have enough of those, right? So even if their schools do have some sort of sexual education program, that's not enough. They might have had a conversation with a counselor at the school 3 months ago, but now there's a new dilemma and a new boyfriend, and there's not really someone to talk with. So I'm just thinking how we can create informal and informal services, more spaces to have young people think and talk about these issues that are so frequent in their lives. And I'm not sure that here, as well as back home, we are able to provide enough of those spaces. So just something for everyone to maybe keep thinking about. And the second topic I'd like to raise is the sense of efficacy of us as adults and professionals to be able to actually speak with young people about this topic. So what I've seen back home is that even though we've all had, even professionals who've had extensive training on lots of issues and how to talk with people, the issue of talking about sexuality is really, really tricky. It's really, really tricky. And sometimes a lot of professionals need that extra help, that extra practice, how to talk about that specifically with young people. And I really want to urge everyone on this call, because I think that this talk has been so awesome, and we have another one lined up for a month from now, and that's great, and we hope to see you then. But even that is not going to be enough. So think about more things that you can do for your teams. You have Amplify as a fantastic resource in the community. You have us as Haruv, who are very happy to contribute if we can to, you know, training, further training of your staff, practicing, having simulations, you know, doing all kinds of stuff in order for you to feel more confident and able to talk about that with youth. So just a couple of thoughts on my end. Dijon, do we have any other things in the chat?
Nope, we just have some thank yous, that this was very informative, education is key. So I think that's it.
So Jenny and Heather, any final messages before we log off?
Just say thank you for showing up for young people, and always feel free to reach out to us directly if there's any resource or anything that we can do to support you all.
Yes, thank you so much. And I appreciate the spirit of being so youth-centered. You know, exactly. Your question is so great. Are there enough spaces for young people to have these conversations? All the conversations. Yeah, we need to create more spaces. Thank you.